The next categories of peptides are our cancer peptides. I discussed in my first video metenkephaline, which is an opioid receptor agonist, and that has amazing effects in multiple cancers. I'm very excited to be able to utilize PNC27. PNC27 accesses the cell membrane of cancer cells very specifically. In a normal cell, we have a regulator called P53, and that regulator would allow a cell to die at an appropriate time. Cancer cells deactivate P53, and that's how they become immortal. PNC27 works by inhibiting the cancer's inhibition of P53. So now we have cancer cells that we can make die. And basically the way it works is that PNC27 punches holes in the cell membrane of cancer cells very specifically. It does not attack any type of healthy cells, which makes it very beneficial as compared to chemotherapy that also kills cancer cells but also normal healthy cells. PNC27 is very carefully used in low doses because in high doses it can potentially cause what's called tumor lysis, which is the rapid cell death of many cancer cells, and that produces an effect where the electrolytes from the cells are released into the body. It's sort of like your body was overwhelmed with toxin, and that can be dangerous. So with PNC27 we use extremely low doses. We also support our cancer patients by using high-dose vitamin C infusions, which in itself supports the immune system, but also helps to fight cancer cells. And we use hyperbaric oxygen because cancer cells do not like oxygen, and in fact they do not thrive in it. So this combination therapy has been very useful for our cancer patients. PNC27 has been used in many cancers, including leukemia, melanoma, ovarian cancer, pancreatic cancer. There's a lot of information about PNC27, and it has been very effective. The next cancer peptide is IRGD. This peptide, it acts in a way as an enhancer to be able to transport drugs into cancer cells specifically. So when this peptide is given in conjunction with chemotherapy, we can lower the dose substantially. It has been shown that cancer patients who use, for example, a chemotherapeutic drug like doxorubicin, if you give it together with this peptide, you can increase the concentration of the drug by 40 times in the cell. So when they have combined this peptide with the chemotherapy, they were able to decrease the cytotoxic drug dose by 3 times, which is significant because a lot of the chemotherapeutic agents, the higher the dosages are, the more toxicity there is for the surrounding healthy cells. So this is also an exciting new peptide for our cancer patients. There are new possibilities coming out every day.